Hi everyone, welcome to Unit 3, Chapter 23, Peripheral Vascular Surgery. So let's say that you've decided to specialize in orthopedic surgery, or you plan to do general surgery. Do you think it's important to be familiar with vascular surgery beyond this class and your cert exam? Well, what if you're scrubbing for a total knee arthroplasty, and the surgeon actually slips with the saw, severing the artery that runs directly behind the knee? Or you're scrubbing for a laparoscopy and the trocar perforates a vessel. You are suddenly scrubbing for an emergency vascular case. So yeah, it's pretty important. For centuries, the practice of bloodletting was favored as a cure for many conditions. It was thought to restore balance and rid the body of disease. In the 1800s, barbers and not surgeons were asked to perform this procedure. A rag would be wrapped around the patient's upper arm and the person would squeeze a white rod in their hands. Then a barber would perform a venotomy with a razor blade and blood would be drained into a bowl. Poles were hung outside the barber shop of a barber who was trained to perform bloodletting as well as give a shave and a haircut. The barber poles had colors. The white on the poles represented the white rod that patients would squeeze in their hands. The red stripes represented the bloody rags, and if blue was included on the pole, and it was sometimes and other times not, it represented the blue color of veins. The peripheral vascular system transports blood away from the heart to target tissues and is made up of blood vessels. Vessels called arteries transport oxygenated blood away from the heart. However, there is one exception to this description, and we'll explore this later on in the lecture. Arteries transport blood into smaller and smaller arteries called arterioles. The smallest vessels are microscopic, single-layered vessels designed for the exchange of nutrients and waste between blood and surrounding tissue. Within the capillary beds, oxygen is diffused to nourish target tissue, and waste such as carbon dioxide is taken in. Once the exchanges occur, blood flows into small vessels called venules, which gradually increase in size to become veins. Veins transport the now deoxygenated blood back to the heart. As with arteries, there's one exception to this description. Anatomical diagrams and drawings often show arteries as being the color red and veins as the color blue. Does that mean that venous blood is blue? After all, it does look blue when you look at the veins in your arms or legs. But it isn't really. It's just convenient to color diagrams in this way in order to distinguish veins from arteries. However, there is a difference in the color. Arterial blood is bright red, caused by the oxygen that it is carrying. Venous blood is a much darker red due to its lack of oxygen. Blood vessel anatomy. Blood vessels, both arteries and veins, have three distinct layers. The tunica externa, also called the adventitia, is connective tissue that adheres the blood vessel to surrounding tissue. The tunica media is the middle layer made of smooth muscle. Vasoconstriction occurs when the muscle contracts, and vasodilation occurs when the muscle relaxes. This affects the diameter of the lumen and results in either a rise or fall in blood pressure. The tunica media of arteries is stronger and thicker than the same layer within veins. The tunica intima is the smooth inner layer of blood vessels. The intima projects into the lumen of veins to form valves which allow for a one-way flow of blood. Valves are not needed in arteries. To easily remember this, think, veins have valves. Circulatory system. The circulatory system consists of two circuits. The pulmonary circuit, controlled by the right side of the heart, and the systemic circuit, controlled by the left side of the heart. Then the pulmonary circuit, the blood flows from the right side of the heart to the lungs and back to the left side of the heart. In the systemic circuit, the blood flows from the left side of the heart through the body tissues and back to the right side of the heart. Our heart pumps for both circuits. The two circuits work simultaneously to provide a constant supply of oxygenated blood to our bodies. Blood pressure is the measurement of force applied to arterial walls. And your blood pressure is expressed in two numbers, systolic and diastolic. Systole occurs during the contraction and emptying of the heart, and diastole occurs during the relaxation and filling of the heart. Normal blood pressure is written systolic over diastolic and is normally less than 120 over 80. As the blood pressure goes up, and you can see in the chart, more and more pressure is put on the walls of the artery. A blood pressure of 160 or higher over 100 and higher is extremely high hypertension and is very dangerous. There are 4 factors that affect blood pressure. The first is our blood volume. We normally have about 5 liters of blood in our body. If there is a lot of bleeding, then that will certainly affect the blood pressure. The second factor is the strength of our heart contraction, and this depends upon the health of the heart muscles. The third factor is resistance, and that speaks to how open the arteries are. If they're clogged with a lot of plaque, then that will affect our blood pressure. Blood viscosity is the fourth factor, and that refers to the thickness of our blood. Blood pressure, while is normally measured in the arterial walls, can also be measured in the veins. This is called the central venous pressure, and it measures the pressure of blood in the thoracic vena cava, which is near the right atrium of the heart. It reflects the amount of blood that is returning to the heart. Normal central venous pressure is 2 to 6, which is much less than the arterial pressure of 120 over 80. It's measured by a central venous line that's threaded from a large vein into the vena cava. Our pulse points can be either felt, called palpation, and this you can feel with your middle or index fingers, or auscultation, which means to hear, using a stethoscope. If you place your 2 index fingers over your radial artery or brachial artery, that's the carotid artery, you can feel this. So take just a moment now to do that. The normal resting heart rate is approximately 60 to 100 beats per minute. Tachycardia, which is a fast or increased heart rate, is more than 100 beats. And bradycardia is less than 60 beats per minute, which is a slow heart rate. In this video, we have discussed the peripheral or vascular system and talked about the 2 circulatory systems, the pulmonary and the systemic system. We also discussed blood vessels and the anatomy of these blood vessels, arteries, arterioles, capillaries, venules, and veins, and we compared the similarities and the difference between the 2. We discussed blood pressure and pulse rate. Join me in our next video to learn about some of the major arteries and veins in our body. Thanks for watching.